Hello, everyone. Welcome to another Akamai EdgeTalks. So for the ones who are new, the Akamai EdgeTalks aims to bring guest speakers, especially external to Akamai, where they offer their time, they offer their knowledge, they offer their learnings as well to us. And the idea is just, bring different ideas, different concepts that we can use to, build our growth mindset. So perhaps you'll get inspired as well. And if you haven't looked at our YouTube channel, the previous Akamai Edge Talks can be found there. So we have already done, I think, 4 or 5 of them. And so if you go to our YouTube channel, you'll be able to find them there. So I will actually recommend you to go there and watch them on demand if you want. We have interesting speakers as well with interesting topics all the way from, traveling to build a startup, to mental coaching as well. So if you are into those topics, have a look. We have our Edge Talks sessions there. Of course, we are recording this one and we will make this one available as well. So for the peoples in your team, feel free to share the word and redirect them to our YouTube channel. So as you know, we are, expanding this kind of initiative or project. So I'm looking for volunteers. So if you want to be a host, or if you know someone that could be an interesting speaker to us, just nominate them, share with them the Akamai EdgeTalk concepts, share with me their names, and then I will be working closely with them so we can schedule the next ones. If you want to be a host, feel free to contact me directly as well so we can, join the efforts and do this together. And so for today's session, I'm very, very happy to have Marija Butkovic. She's the founder and CEO of Woman of Wearables. She has been a Forbes contributor as well, writing a lot of articles, and helping female entrepreneurs in the tech industry. So helping startups in the health industry as well. And she has been part of many events. She's a speaker usually. She's very passionate about female health, especially in the enterprise and corporate environment. She has been traveling a lot, so she has a passion for traveling all the way from east to west of the world. And today she's here with us just to talk about female health and how that's important for companies' performance. She will go through some of the challenges, some of the solutions, what are the implications of female health as well. So I'm quite keen to learn more from you, Marija. So welcome to the Akamai Edge Talks, and whenever you are ready, feel free to take it out.
Thank you so much, Jonathan. Thank you for inviting me. Hi, everyone. As Jonathan said, I'll be delivering a talk about women's health, something I've been deeply passionate about over the past few years, and I will share a bit of a personal story as well. But let me share my screen first, and then we can kick it off. Let me know if at any moment you cannot see something or cannot hear, and we can amend. So women's health topic has been something I've been deeply passionate about over the past few years, ever since I became a mom myself. And until I went through my own pregnancy, I was blissfully unaware of how actually this world is built by men for men. And I will share some really great examples of this with you. And I will also tell you a bit more about connotations of women's health, innovation, and best practices in the workplace, something that any company should pay attention to, because at the end of the day, there's 51% of women on this planet. We are not niche. So our health should be a priority, not just within the workplace, but also in the society at large. So as Jonathan mentioned, I'm a founder and CEO of Women of Wearables, which is a global organization that was initiated 2016. I was scratching my own itch with it. Basically, I was a co-founder of a wearable tech startup at that time. And I realized that London was all about fintech and banking and software, but there wasn't much talk about wearable technology, its implications on health and women's health. So I started Women of Wearables as a very small meetup group. Over the years, through the content and events and everything that we've done, we have become a really big global ecosystem that now spans across almost 60 countries and 5 continents. So we do anything from workshops, panels, office hours with investors, conferences, all the way to mentorship and thought leadership and advocacy for women in the tech space. I'm also writing for Forbes. I'm a Forbes contributor. I will, if anyone is interested, I can drop my Forbes page in the chat box if you want to read some of my stories, or you can just Google me and find me there. I'm dipping my toes in the investment space a bit as well, and I'm working with lots of startups and women who are maybe transitioning from corporate career into the startup world. And in general, I'm a very big diversity advocate and feminist in general, because I think that women have to support women more in many environments, but especially in the workplace. But also equally, I'm trying to engage more men in these conversations, because men can be our allies indeed. So let's get started. I want to share first with you some examples from a really great book. Maybe some of you have heard of the book, but if you haven't, I really recommend you reading it. It's called Invisible Women. Caroline Criado Perez is the author. This world, as I mentioned, was really built by men for men, and it can be seen on so many examples. For example, car safety. I found this stat that cars are 71% less safe for women than men because they've been designed using a male dummy. So, and you can find a lot of information about this on the internet as well. In many office, temperatures are based on a formula that basically uses metabolic rates of men. So usually if you're a woman and you feel freezing during, let's say, summer or spring when ACs are on in the office, it's probably because of that. When Apple introduced Siri in 2011, you could use it, for example, to find a Viagra supplier, but not an abortion clinic, for example, in the US. And even more so, you cannot do that today, unfortunately, in many US states. In terms of medication, you'd be surprised how many drugs and medications have been developed, using majority of men participants in clinical studies. And this is something I'll be mentioning a bit later as well. They don't work when women is on their period. In many situations, they won't work, or they won't adequately work, or they will be suboptimal. And it's precisely because women haven't been included in clinical trials enough or at all. And I will mention this in a minute. When it comes to voice recognition, 70% less likely it's to accurately understand women than men. Algorithms are used that are trained on male data sets rather than female data sets. So that's a very big obstacle in many sectors, I would say. And parking spaces for pregnant women, for example, in companies such as Google, haven't been introduced until 2014. Sheryl Sandberg, who was CEO at Facebook, before Facebook, she was at Google. And when she was pregnant, and she wrote about this extensively in her book, Lean In, she realized that nothing in the company was actually set up to cater to pregnant women. So she was the first woman in Google to actually be able to get a wider parking space when she was pregnant, when she had her baby. And she paved the way for many other women within the company to receive the same benefit, as we would say, but it should be something that's normal, right? So, as I mentioned, it wasn't until 1994 that in the US, at least, that the National Institute of Health, which is the key organization for public health, I would say, in the US, really mandated that females have to be included in clinical trials. And it might sound crazy, it might sound, incredible that this has only been achieved, 30 years ago, but that's the case. Before that, any pharma company or any company that has been developing drugs or anything in that realm could easily have, let's say, 90% men included in the trial, and still the drug would be administered to women. And that was particularly the case, for example, for younger women, for women with different socioeconomic backgrounds. pharma companies would usually use the excuse that it's very hard to find those women, it's too expensive, and this is precisely something that the National Institute of Health mandated, saying you cannot use these excuses. You need to have equivalent number of women from all sorts of backgrounds or all sorts of age groups included in trials. So that's where actually the real revolution started. And this is something that has impacted our health a lot, and it has impacted our health all the way until today, because it has affected our health in so many ways. For example, by not knowing, by having this massive gender data gap when it comes to clinical trials, women have been over-medicated in many situations. We have been experiencing adverse drug reactions nearly twice as often as men. Many studies have shown this, and if you do a bit of research on this, you'll find this. There's a real gender bias in the medical space. There's a real case of medical gaslighting for women who are not trusted. I've experienced that myself when I had my son in many ways, and this also translates into doctors not being equipped with enough knowledge around what should we be paying attention to when it comes to diagnosing women, which is one of the main reasons why, for example, cardiovascular diseases are the main cause of death in women today in any developed country. Now, you might think, oh, how is that? Why is that? Well, it's because in many cases, including cardiovascular diseases, symptoms that women experience are way different than men. But because we haven't had enough research on women, we haven't had enough clinical trials, or we haven't had enough adequate drugs developed, we simply don't know. We are tapping in the dark. And ultimately, that also translates to less tough topics, for example, like periods, something that is very natural, but has been a taboo or stigmatized topic over the years. Menopause as well. I'll be mentioning about menopause a bit later as well. Until 2025, there will be 1.2 billion women going through menopause globally. So it will become a silent pandemic if we don't think about how can we help women who are maybe going through tough periods in the workplace. Some stats around women, just to show some perspective and the magnitude of the problem. In the healthcare space, 65% of employees are women. So, for example, if you look at NHS, I think it's even a bit higher. Women spend more on healthcare than men. Women use a lot of digital health apps. Women use a lot of mental health apps. Women use a lot of apps that help them, track their, as I mentioned, periods. With the revolution of digital health, women are pushing more, I would say, for equality when it comes to access to better healthcare. And they are very open to using medical devices and wearables to support their health. And especially now when wellness and well-being and beauty have started at the intersection as well of health. So all these sectors are somehow intertwined a bit. So they're not existing in a silo. We are seeing more women actually thinking about health in a very holistic way. And ultimately, 80% of healthcare decisions are made by women. If you think about maybe your own families or yourself, women usually take care of their whole family, reminding their husbands to go to the doctor, taking children to the doctor. Down the line, we have to take care of ourselves, and down the line, sometimes we end up caring for our sick or old parents as well, and other family members. So if we think about the role of women in the society when it comes to healthcare, we don't have only a role as patients. We have a very big role as caregivers and as consumers as well. Problem here is that in many cases, in many sectors, including, healthcare, innovation, tech, health tech, venture capital as well, you won't find enough women on senior positions and leadership positions. Not to mention that you won't find almost any or very rarely women of color on these positions. And this is a really big problem because it shows that not only the world is made by men for men, but also that this is a world of white people. And that's a massive issue, because the research in many cases, clinical trials have shown that many diseases or illnesses or anything related to our health might differently impact people of color. So that's a completely separate category that I won't go very much into, but it's a real problem that exists. And just to show you an example of that, Black women, for example, in the UK and US are 3 times more likely to die at birth than white women. And if you have followed news over the past couple of weeks, you might have seen that Black Olympic gold medalist Tori Bowie in the US died when she was 8 months pregnant because of complications at childbirth at home. And that just again shows the magnitude of the problem, because the healthcare systems are not equipped to cater to women, but especially to women of color. So I want to talk now briefly about Femtech. Maybe some of you have heard of the term Femtech, but maybe you haven't. And this is something that we have been at WOW, at Women of Wearables, doing over the past few years. And we have been following the trend, and we have been building a community of Femtech innovators. So Femtech in general is a term that was coined by one of the leading Femtech founders in the space, Ida Tin, who's the founder of Clue app, which is the first period tracking app ever. It originated, I think, from 2016 when she was pitching to investors, and she was mostly pitching to male investors, her startup. And you can imagine what happens when you pitch a period tracking app to a male investor who probably doesn't have a clue about this, not to mention that you cannot say words like vagina or anything else like that. So it has been very tricky, and investors didn't understand much about what she was telling them about. They didn't understand the size of the problem. They didn't understand the size of the audience. So she coined the term Femtech, which basically is a term that is applied to any category of software, diagnostics, hardware, product, services that use technology, focusing on women's health. So the term remained until today. And if you type in Femtech, you'll find millions and millions of pages and articles and organizations and communities focusing on this. I'll give you some examples of Femtech, just so you can get some kind of idea what it is. As I mentioned, period tracking apps, there are many of them. Innovative pregnancy tests. I wrote about this for Forbes, I think last year or 2 years ago. Royal National Institute of Blind People and Short-Sighted People worked on a really interesting campaign where they developed this pregnancy test, basically, that use Braille alphabet for people who can't see. Because when you think about it, if someone is blind, how do they do a pregnancy test? How do they check if they're pregnant, right? They always need to have a companion help them with that, or do it with a doctor or a trusted person. So this is really great, incredible innovation that shows that you really have to focus on people with disabilities as well. We cannot just discard them as, oh yeah, technology is not for them. For moms or new moms, you have whole new range of wearable breast pumps now, like British brand, UK brand LV, and in the US Willow are doing this. So it's very convenient, it's silent, it's efficient. So we all have very busy lives, and I think this kind of innovation has really helped women probably to multitask even more, if I may say. But we can discuss whether this is good or bad, but it's definitely something that's way more convenient than before, what existed before. In the medtech space, or like biotech, medtech space, medical devices space, we have a whole new range of companies treating all sorts of problems, such as postpartum hemorrhage, so the excessive bleeding that can follow childbirth, all the way to devices and apps for pelvic floor. If there are any women here who have given birth, you might have experienced, weak pelvic floor muscles. And I know that for 6 months after I gave birth to my son, I was peeing every time I would sneeze or laugh, and it can be a really debilitating condition for some women. And then there's a whole also new range of non-contraception available out there, and I think that's one of the greatest examples of how technological innovation has democratized access to better healthcare for women. Because maybe 10-15 years ago there wasn't that many non-hormonal contraception options for women, but today there are many. So that's really, I think, excellent. It shows that the movement is going in the direction of giving more options ultimately to women. There's a whole range of sexual health startups. Fertility is a separate category for both men and women, because fertility is not just a women's issue. So there's a lot of great innovative companies in this space. And then there's the next generation of femcare products, which is period products, flushable pads, organic tampons, CBD infused tampons, and things like that. So there's the universe of femtech is really great and massive. It's estimated to be worth 1 trillion by 2025. Probably it's even more. And I found a stat that around $14 billion has been invested in femtech in 2020. So that's still nowhere where it should be, but it's definitely showing, I would say, a right direction. Unfortunately, in general, when we think about investment in the healthcare space, only around 40% of overall funding goes for research and development for women's healthcare products and services. And this is because of many reasons. Many don't see the opportunity. Many think that the market is not big enough. Many think that the path from establishing the need and doing all the clinical trials and establishing what the real data gap is would take too long. So there are many reasons, but it's slowly happening. It's slowly changing, but again, it takes a bit of time, because the general awareness about the importance of women's health has only become, more apparent, I would say, over the past maybe 5 to 10 years. So in 2020, as I said, Femtech received only 33% of health tech funding, and you can see on this little chart here which areas have received most funding. So sleep research is on top, and then maternal health, dietary supplements, tobacco smoke, ovarian cancer, which is the leading cancer for gynecological cancer for women, infertility, cervical cancer, breastfeeding. One might say, actually, that when you think about it, that women's health is mostly about reproductive health. And that's only partially true, because reproductive health has been the first area of women's health that has been given more funding and more awareness and more research. But women are not just reproductive machines, right? Like, we don't just give birth and give children to this world. So the trend now shows that a lot more research and discussions are going towards non-reproductive health topics, are going towards autoimmune diseases, different chronic conditions, mental health as well, menopause, Alzheimer's, osteoporosis, brain health, which I think is excellent. And again, in many of these conditions, symptoms are way different for women than for men. Problem again here is venture funding, as I mentioned. Recently, there was a news, maybe some of you have seen it, that with the backing of Peter Thiel, I don't remember the exact name, but there's a new fund now in the US that has 200 million assets under management to invest just in women's health. A bit of a problem there is that Peter Thiel is very much anti-abortion. So I'm very curious to see how that will pan out, because if you ask me, anyone that invests that amount of money in women's health has to be very open-minded and be able to accept, the freedom that women should have when it comes to our bodies and our health. So we'll see how that one will pan out, but it's definitely a good decision. I think any funding that can go to women's health is a great trend, and I hope we have more funds in the future. Because 2/3 of the femtech founders in the ecosystem are women, that also gives us a bit of a leverage, I would say, because research has repeatedly shown that companies with female founders or CEOs really do achieve higher return on investments when they get funding, when they get investment, than those led by men. And I think Boston Consulting Group, maybe a few years ago, did an excellent research on this topic, and they have analyzed thousands of startups, and they came to the same conclusion. So stats are there, numbers are there. It's just that convincing investors is a tough nut to crack. But I think that with more exits, we'll see more funding also going to femtech space, and I will share a bit more about exits as well. 80% of healthcare VCs have never invested in healthcare products for women. So although, venture capital funds that invest in health tech or digital health or healthcare in general should be sector agnostics, audience agnostics, they've never ever invested in anything for women, which means that the pool of investors that do invest in women's health innovation is actually really small, regardless of the market you're looking at. So whether it's US or whether it's Europe. And I won't even, go into Asia, because Asia is culturally different. It's still very, very nascent. It's still very at the beginning. So some notion about what women's health is and the openness and discussion needs to completely change in some markets. But that's how just the world operates, right? Problem with the venture funding is not only the lack of money or lack of conviction when it comes to investors, but also the lack of women in the space, again, because you'll probably find in many VC funds a lot of women at lower positions like analysts or associates, entry-level positions, junior positions. But the higher you climb, the more you go towards principal roles or general partners roles or even LP partners roles, right? So people who do put money into funds, you won't find that many women. And again, number of women of color that are in this space is below 1%. And you cannot be what you cannot see, right? Like if you don't see a Black woman or a woman of color or women in general at the helm of a VC fund, that will be detrimental to your own decision whether you want to get involved in this space as well. Women are very often not trusted when they ask for money. They ask for less than men. And yeah, that's just how it is, unfortunately. And I'm hoping that this will change, and maybe Femtech movement will help change this a bit. I'm really hopeful about this. We have done a lot of work at Women of Wearables around office hours with investors, and we compiled a list of investors, and I wrote about this for Forbes as well, because I think it's really important to shine the light on these women and just give them visibility. More often than not, male investors or male men in general, they will write about other men or they will invest in other men. I'm not saying that we don't have male allies, we do, but I almost see it as my own duty to give visibility to these women. So this is why I'm part of Forbes Women Contributor Network, and my area of writing is always women, whether it's women's health, whether it's women in tech, whether it's women in venture capital space. Some of the Femtech exits that I want to mention here, which just show the opportunity, the business opportunity that exists, are Candy Therapeutics, which is a UK-based company. They were quite young when they were acquired by Bayer in 2020, and they were acquired by 425 million. And they were still very early. They developed this protein for some drugs for menopause, for example, and it was so revolutionary that Bayer snapped them. In the US, we have some really interesting companies like Modern Fertility, which was a fertility platform, digital platform for couples that are facing infertility. And they were one of the pioneers in the space, I believe. And they were acquired by another company, Roe, for 225 million. And then you have very specific niche sectors like fibroids, right, which doesn't affect all women, but the market is still very, very big. And there was a really great acquisition in 2020 on this. So women's health is complex. I think we can definitely say this, and that shows the opportunities as well that exist in the ecosystem, because you can focus on one little thing, but if no one has been doing that much work in that space and it's still done in very old school way, that really offers startups opportunity to innovate and to provide a better solution to this audience. And then some of the other really big opportunities, as I mentioned, are menopause. I'm pretty sure that most of the companies now, especially big companies like Akamai, have some solutions in place for women that are going through menopause, whether it's reflected on employee benefits or workplace conditions. But equally, maternal health is still a very, very hot topic. We have done a lot of work around maternal health. How can employers support pregnant moms, pregnant women, new moms, and how can we really be supportive of them? Because support doesn't end when you get a child. And I think that's one of the biggest lessons that I've learned. A lot of companies think, oh yeah, we have had these really great flexible working environments, and we have given them really good salary or opportunity, financial reimbursement during their maternal leave, but then when they come back, that's it. Our life hasn't stopped just because we have given birth and we have come back to work. So this is something I hope more employers will really carefully think through and see as an opportunity to improve what they're offering to women. And then support for aging women, as I mentioned. Women 50 plus of age are very wise, and they bring a lot of knowledge and wisdom to the company. And but equally, our health deteriorates after that age. So companies do need to think about, okay, how can we get the best from these women while at the same time supporting them and their health?
Marija.
Yeah.
Can I ask a quick question? Sorry for
Of course. Go ahead.
So yeah, regarding the previous slide, do you have examples of like solutions or benefits that companies can put in place to tackle some of these challenges?
Yes, and I have one of those slides here, and we can talk about it now. Yeah, so I compiled some examples what women in the workplace are actually facing in many companies. And this is research that has been published by one of the leading startups in the Femtech space in the UK, Peppy Health. So again, many of these issues are very much women related, women reproductive health related. So for example, many working age women experience more women's health conditions, whether it's a very painful period, whether it's menopause, whether it's infertility. Spain has introduced paid menstrual leave recently. Many employers are saying that, because of women's health issues or maybe not catering to them, they're having challenges with attracting and retaining female talent. Many women are not comfortable talking about women's health issues or their issues with their bosses or managers. Endometriosis, for example, is a really, really big problem that many women face, but on average, it takes 7.5 years to get diagnosed with endometriosis, unfortunately, in the UK. And during that time, you will have many hours lost and days lost of work because it's a very painful, debilitating condition. So supporting women at work, just some very, very simple things that companies can do. I have a friend at Goldman Sachs who recently told me that she asked to get a fan on her desk. She's going through menopause, right? And she had to go through, I think, 7 approvals, and it took like 3 months until they said, okay, yes, you can install a fan on your desk in your office, because she has hot flashes. Anyone who's going through menopause, mostly women will have hot flashes, right? So it's a very simple, stupid solution, but it's very efficient. Do you have washrooms? How are your toilets done? And, is there anything that you can do there to help women? If a woman is wearing a uniform, can we adapt that? Can we change that? Obviously, in Akamai, that's not the case, but in many companies, that is the case. Flexible working options, shift patterns, frequent toilet breaks, sanitary products, very important one. And it breaks my heart when I see that many companies don't have this. Have free sanitary products available in your bathrooms, pads, tampons, whatever. It's a really, really cheap way, but it's an excellent example of supporting women. So when I run out of my pads or tampons, I know I can get those in the bathroom. There's a really cool company in the US. It's called Femly, and they make their own tampons and pads, and they install these little like pods in the company through which you can get this. But even without this is something that could be very much doable. Quiet space for timeout as well, if and things like that. I've seen a lot of great companies now realizing that through employee benefits they have to provide value to their employees. So companies are actually thinking about, okay, what are the options? Do we cover the cost of IVF? Do we cover the costs of any treatments that women have to go through? Do we cater to these women by providing them mental health support? I think, having a coach or mental health support can be incredibly important. Education, I would say, of HR managers and HR leaders is also super important, because more often than not, if there is maybe a big age gap, or I don't know, if we have two different groups, so maybe we have a woman that's going through menopause, but HR manager is someone in their 30s, they might not be able to identify themselves with the problem. That's why I think it's really important to provide enough education and context about these things. And equally, I think it's very important to educate men. Men are, again, our allies. Men are very often, more often than not, blissfully, completely unaware what women are going through. When you think about our hormonal health, men's hormones are the same every day. They do a full circle after 24 hours. Women's hormonal cycles are 30 days or 28 days, depending on your period. So it's very cyclical. It's very much like this. And men don't understand, but we have to work in synergy, I would say, and we have to do it in a way that we have very open conversations, and we have to do it in a way that there's no taboo topics or stigmatized topics, because at the end of the day, I think everyone is equally worthy, and all employees should be seen the same. Just because some employees should need some things more, or you have to cater to them a little bit in a different way, that should make the difference. And again, as I mentioned, once women get children, we shouldn't stop seeing them as someone who does need maybe some additional support here and there. I have a friend who works in Austria, acquaintance who works in Austria, and she works in a really big bank. So on site, they have a nursery. So every morning she will drop her child to the nursery, and she will go to work. And then at 5 p.m., she'll pick her children from the nursery that are part of as part of the building where the bank is, right? So that would be an ideal solution for me. That would be amazing if something like that existed. It's a science fiction still for many companies for any reasons, but this is a real example how supporting women can really be beneficial. Supporting family can be really beneficial for women as well. And I think it's ultimately all about how do we help all our employees, including women, become better leaders? Because if we feel comfortable, if we feel heard, if we feel that someone is listening to us, and if we feel that we can really be impactful in our work, and the whole environment around us is supporting us, we can really, stay in that job, which is the main reasons why I think one of the main reasons why many of my female colleagues in the corporate world or in the tech space or big consumer brands, they're not staying at their jobs simply because they have a good salary. They are staying because the working environment is really, really good. And it's very trustworthy. It's very understanding. It's very open. It's very open-minded. It's very just forward-thinking, I would say. If you want to be a forward-thinking employer of the future, you cannot ignore your female employees. You just have to take into account that times have changed where, women would get same benefits as men, or, we would treat them more equally. Of course, we want to be treated equally, but we cannot dismiss that we are still different in some things. Not necessarily different in a bad way, but just different. And I think companies need to acknowledge this and need to act upon this. And very briefly, before, if anyone has any other questions, see it as your duty. I think, employers have a duty of care for the women who work for them. That's simply the way it is. And yeah, I'm really happy to see that there's a lot of great companies in our community at Women of Wearables who are really walking the walk, not just talking the talk. So yeah, if we can provide any other resources for you, or if you're interested in any of these topics, we have a whole database of resources or webinars we did, of innovation sessions that we have done over the years on these particular topics, whether it's women's health innovation, whether it's women's health investment, whether it's motherhood penalties, one of the really big topics, and women's health in the workplace. So that's basically it. And yeah, most of this is what I've already seen. So about Femtech and filling the gaps in women's health data and democratizing access to healthcare services. So it's a big industry. It's a very, very interesting industry, very engaging industry, very innovative industry. If anyone is interested in hearing more, just drop me a line and I can share some of our resources with you all. This is my contact detail, and you can connect with me on Twitter and LinkedIn. And I will just finish with a quote from Michelle Obama, who said that communities and countries are ultimately the world are only as strong as the health of their women. And I think that could be more true. So yeah, that's all for me for today. And happy to share, Jonathan, some additional resources for everyone who stick to the end and anyone who will be watching this session on YouTube.
That's amazing. Thank you so much, Maria. It was very insightful. So we have now a few minutes for Q&A. So if you have questions to myself or Maria, please just type them on the chat and I will read them and then we will answer them. So let's see how much time we have.
If that's okay, I will share also our Femtech group in the chat, which is, we have still fairly small, but definitely the biggest on LinkedIn because it's still so early stage for the Femtech space. I will share it here in the chat box. If anyone wants to join, you can join the group. We have a lot of leaders there, actually. We have people from, leading innovation at Dyson, to people from Google, to people from Facebook, because many of these companies are doing a lot of great things internally, but they are also looking to support external organizations focusing on women's health. So I've added that. And then if anyone is interested in reading some of my stories for Forbes, I will also add my page where you can read more about very interesting companies that have raised funding, or you can read about, I recently wrote about women's health in England. And something that I didn't mention, but I can mention now definitely, is UK is the first country in the world now that has women's health strategy. And we have a women's health ambassador that was appointed for England, which is Professor Dame Leslie Reagan, who's a really almost famous gynecologist, but she also works as a big advocate for women's health in the UK and England. And the women's health strategy in the UK is something that government initiated by recognizing that actually government need to step in if they want to see a certain issue within the healthcare realm being solved in a better way. And they had an open call, I believe, in 2020 and 2021, and they received 100,000 plus responses from advocacy groups, female patients, doctors, healthcare providers about what actually doesn't work in the US and within the NHS when it comes to women's health. So have come with a strategy that pinpoints areas of interest, more funding that will go to women's health, building different women's health innovation hubs, investing more in trusts across the England and the UK, and so on. It's a very interesting one. You can find it on GovUK website, and it's a really great example how we can lament about what startups should do, what our investors should do, what corporates should do. But ultimately, unfortunately, with such a big issue as women's health, until government steps in, we probably won't see meaningful changes for the better. So I think that's definitely a very positive step forward.
Okay, yeah, that's amazing. I do have a question for you, which is, it seems to me that most of the time we are throwing the ball to our employer, right? It's like, oh, they should give us benefits, they should do this, they should do that. And sometimes I do think the solution comes the other way around, which is as a human being, especially woman, has to take the first step. But because this is such, especially in some cultures, this is such a taboo that people don't feel confident to raise these issues. So do you have any tips on how women can feel confident to, just raise these issues with their managers or bosses or like even their employers? And so
that's a good question. That's a good question. I would say that something that I've seen always works best, similar to the hiring process, is having both male and female, maybe HR managers, because you always need to have a choice. Maybe at some point, I'm okay talking about my female health issues with a male manager, for example, but maybe younger women are not. So we have to have that in mind. Also, I would say this whole awareness and positioning of a brand or an employer around how flexible or how forward thinking we are or how open we are has to be seen in multiple ways, right? Like if you want to support female employees, just giving them some options to employee benefits won't be enough. So have open discussions, organize maybe meetups of women within your company, very informal ones. It doesn't have to be a formal one. Organize talks like this one. People will feel empowered. I think ultimately people need to feel trust, but people also need to feel empowered and also people need to see others having similar issues. If I think I'm the only woman having maybe endometriosis in my company, I'm not very likely to step in and say, hey, I have endometriosis. I need a solution for this. Can you help me? So I think it's really important to emphasize positive other examples of women in the company who are facing whatever they might be facing, and just say, hey, we are supporting them and we can support you as well. That support network is invaluable, just having a support network. And I think that's something that has proven even more important, I think, during the pandemic and after the pandemic, now when people are coming back to the office, because we want to feel supported. And sometimes support doesn't even have to be anything formal. It can be just a regular chat or chat to a colleague or just feeling very safe in your working environment. But it's a lot of little steps. It's like connecting the dots.
Right. I like that. Thank you so much for giving us some nice insights on woman health. I hope you had fun with us.
Yes.
Yeah, see you next time.
Thank you so much. Thank you, everyone. And please do reach out if you want to connect with me. I would love to connect with some of you. Thank you.
Thank you. Cheers, guys.
Thank you. Bye-bye.